I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And for this episode, I am joined by Mike Popp, the president of MJP Healthcare Consulting Company. And today I'll be discussing your tribal health centers. And Mike, when we are talking about tribal health center, what is a tribal health center and how might a tribal health center differ from, say, a community health center that people may be familiar with?
So tribal health center is very similar to a community health center. Primary difference in it is you have approximately 600 federally recognized tribes across the country. And many of those individual tribal nations have a health center dedicated to the care of their tribal members within their tribe's boundary or land limits. Some of those facilities are governed by Indian Health Service and run by Indian Health Service, and other ones have what they call self-determined. The tribe has a Self-Determination Act where the tribe is running that healthcare facility for themselves on their own behalf. They have many of the same reporting requirements as a community health center, on top of other federally required reports that they have to submit to the federal government and Indian Health Services.
And what challenges do tribal health centers face with resource and patient management systems or other electronic medical systems? Are there certain requirements for tribal health centers that may differ from other centers?
So many of the tribal health centers today run on a program called RPMS, or Resource Patient Management System. The big challenge that they face using that product today is that product is this run on the same system that Department of Defense and the VA have both been using, the VISTA platform. And that platform is an open source platform, so anybody can kind of do what they want with it. As many of you know, the Department of Defense has moved on to Cerner. The VA is considering their options in moving off of this platform as well and are underway. And so you have these tribal health centers and Indian Health Service being the last primary user of this open source platform. With that said, what's currently in place now under RPMS is a combination of 50 different programs put together to be resource patient management system. There's many challenges for IT in keeping that many programs linked together, working, something not breaking when you try to fix something else. And so in our experience, we've seen a lot of practices recently struggling with all of the changes trying to be made. There's all kinds of regulatory changes that we all know are happening through the industry that RPMS is really having a tough time keeping up with. So it has really become a challenge for a lot of tribes out there to maintain this resource patient management system. There's not always the best support for it out there. It's just kind of possibly at the end of its life cycle. Nobody knows what Indian Health Service is going to do, if they're going to maintain it. I don't believe they know what they do with it or what they want to do with the product at this point. It's just kind of in a holding pattern. And for practices that want to provide the best care to their patients, it's becoming a huge challenge to continue using that piece of software, but help your practice progress.
And in regards to software and product solutions, where does Greenway fit into what's available and how can they assist with tribal health centers?
So Greenway has a full plate of products that we really show to tribal health centers. First and foremost, our community product really fits well into tribal health centers. You have a piece of software that is connected and really works in conjunction with your electronic health record. And community lets you look at your practice from a 10,000-foot view and see where I have gaps in care. I'm able to look at groups of patients lists, patients by comorbidities or diseases or what they may be needing for care, identify those patients and look at my highest risk patients and be able to contact them, get a nurse in touch with them, and really look at how I can keep that group of sicker patients healthier. That's really the overall goal in any medicine today, is how do I have a healthier patient? How do I have a healthier patient base? How do I keep these people out of the ER, out of specialist office, all those high dollar, high cost visits that need to be seen? That's kind of the biggest piece within our practice management and electronic health record system is how do we treat the patient? How do I identify the patients I need to treat? Beyond that, we've got specific functionality for what they call national data warehouse reporting, which every tribal health facility has to track user populations and visit counts, and that affects their annual funding agreements. We've got functionality built in for their annual diabetes audits, which is a pretty specific audit they go through annually and they report on, and that information again gets sent to Indian Health Service. We've built what they call HIPAA reports. It's very similar to our MIPS, or meaningful use clinical reporting. And another big piece that we have built into our software is a full purchase referred care module where tribal health facilities have to track outgoing visits to specialist office and then track what needs to be paid to those specialists, all the reporting built in, or all the requirements that they have to do on the back end. We've got completely built into our software. So as we meet with all the tribal health facilities all across the country that we've had, we have the functionality built into our system today to have them up and running and going without need for a lot of customization and really handle all their day-to-day needs.
You touched on it a little bit, but are there financial opportunities or regulatory incentives available for utilizing such a platform?
So obviously we have the major meaningful use MIPS measures that are regulatory, but there's still some bonus money or incentive monies available for many of the tribal health centers. On top of that, what we have seen with our current clients through Greenway is that there's an increase in productivity just by more efficient use of the software itself. We're able to reduce a lot of those costs with our community product, but we're also able to help providers see more patients in a day, be more effective with the use of time, just increase productivity overall. We all know that when you increase productivity, your revenue increases on the back end. You're able to see more patients, conduct more visits, bill effectively for those visits, and get paid for them. We train our offices that we work with how to build that functionality into their day through templates in their schedules, through billing training, revenue cycle. And then we also offer services on the back end where groups that need help with coding, or if they need a stronger revenue cycle tool on the back end, Greenway offers an entire service that can help assist you from just a little bit of help to helping you with the full revenue cycle and helping you collect more money on the back end. So it really allows us to kind of tailor a solution to what every tribe needs for their day-to-day business.
Sounds great. Anything else to add at all in regards to tribal health centers?
We've seen and met with many tribal health centers over the years. We've seen a lot of them struggle with what the federal government has given them in the resource patient management system. There's many tribes out there today who are really trying to be a progressive practice. They're trying to offer better care to their patients, better care to their communities, and we've been a great fit for many groups across the country, and just always wanting to try and get that message out that there's options for the groups out there, and we'd love to meet you.
Sounds good. And once again, that's Mike Popp, the president of MJP Healthcare Consulting Company. For more information on the solutions available for your tribal health center through Greenway Health, you can visit our website at www.greenwayhealth.com. I want to thank Mike for taking time out of his day to join me for this episode of Putting Possibility into Practice. I invite you to subscribe to our podcast on SoundCloud or the Apple iTunes Store or Google Play Music, and get updates as to when new episodes are uploaded and available each week for download and to listen to. I'm Joe Augustinelli, Social Media Manager at Greenway Health. Thank you for listening to this episode of Putting Possibility into Practice.